Hi everyone, and welcome to a presentation on neurotransmitters. This is the other video that you need to watch in addition to the video on neurons. So, I am going to go through 5 different types of neurotransmitters that you will find within neurons in your body, and I will talk about their function, and I will also talk about examples of where we see malfunctions or situations where there's too much or too little of it, and what kind of effect it can have. So the first one we're going to talk about is acetylcholine, and its job is really to allow us to move our muscles, to learn, and for memory purposes. And so when we see a deficiency in ACH producing neurons, or when they start to deteriorate, this is where Alzheimer's comes in. So you typically might think of Alzheimer's in connection to memory. Well, that's exactly why, because these neurotransmitters that are responsible for helping our memory are deteriorating, and thus Alzheimer's is a disease that we can contract. The other one is dopamine. Its function is to influence our movement, again, also our learning, our attention, and our emotion. If you have too much dopamine, it is typically linked to schizophrenia. And if you are starved of dopamine, the brain produces the kinds of tremors and the lack of mobility, as we talked about here in its function, that you see in Parkinson's disease. And so for a lot of these brain diseases, typically it's a result of either too much activity with a neurotransmitter or too little. The next one is serotonin. This one affects mood, hunger, sleep, and arousal. Undersupply of this can be linked to depression. Antidepressant drugs like Prozac or Zoloft, their job is to raise the serotonin levels in your body to help regulate these things that your serotonin is supposed to do. The next one is norepinephrine. Its job is to help control alertness and arousal, and this can also depress your mood if you don't have enough of this within your body. And our last one is endorphins. Their job is to lower pain and to allow us to have feelings of reward and pleasure. And so also without these, that reward and pleasure feeling is not there, and this can really also depress our mood. It can also increase the pain that we feel if we encounter some sort of painful moment or two, some sort of injury of some sort. So go back through this as you need to, but these are the neurotransmitters that you are going to be responsible for knowing. So take care, and we'll talk more about this tomorrow.